Good afternoon, everybody. Thank you all for being here today. My name is Lizzy Davidson. I'm a senior here at Duke. I'm majoring in biology with minors in chemistry and psychology.
And my name is Vignesh Pirapaharan, and I'm a junior studying biology and global health.
We're very excited for the chance to share with you all our project, which investigates the role of physiotherapy in Ugandan neurosurgical transitional care, which is a mouthful, so let's get into it. So to start, I'd like to introduce our team. We are a global team of students from both Duke University and the Mbarara University of Science and Technology. Our focus is on rehabilitation care specific to patients suffering with traumatic brain injury, TBI for short. TBI occurs when a sudden, external, and often violent event causes damage to the brain. In Uganda, it is a leading cause of hospital admission. And for context, Uganda is a low-income country in sub-Saharan Africa with about 170 cases of TBI per 100,000 people. This rate is actually 3 times that you will find in high-income countries and is often due to things such as road traffic accidents. So as you can imagine, TBI can affect every aspect of life, and rehabilitation services exist to help expedite full functional recovery, such as physiotherapy, occupational therapy, speech therapy, and neuropsychology. Our project focuses on the specific realm of physiotherapy, seeing that it is the most widely developed rehab service in Uganda.
So let's consider what happens to a person with a TBI. There's the initial accident, and shortly they would be receiving medical care at the hospital. During this medical care, they might encounter their first session of physiotherapy, and soon they might be discharged. But what happens after discharge? While mild cases might only take weeks to recover, moderate to severe cases might take from months to years. And this is why it is important to consider outpatient physiotherapy. However, even in high-income countries, up to 60% of neurological patients drop out of physiotherapy care from home to the hospital. Thus, we aim to develop a care transition framework which is appropriate to the Ugandan healthcare system to improve and promote outpatient physiotherapy follow-up after discharge. To this end, we'll be working with the 2 largest public hospitals for neurosurgery and physiotherapy in Uganda, and they would be the Mulago National Referral Hospital and the Mbarara Regional Referral Hospital. For the first year, we focused on the hospital side of the care transition framework, and more specifically, we focused on discharge planning. Discharge planning, in simple terms, could be devised as a protocol by experts to the patients who are leaving the hospital to ensure that they receive physiotherapy care in their local PT clinics. And to this end, we looked at the perspectives of neurosurgeons, nurses, physiotherapists, patients, caregivers, and documentation from medical files. From our initial interviews with patients, providers, and caregivers, we found that discharge planning is a truly complex and interprofessional process, and it requires complete efficacy from all those different sectors to make it a successful discharge. We also found that for the patients who were involved in physiotherapy in hospitals, that for the patients who are involved in physiotherapy in hospitals, that continued services were beneficial to their quality of life. To look at what discharge planning was, we initially looked at the steps of discharge planning by the experts, and we then surveyed to see the frequency of these steps. Preliminary findings revealed to us that 43% of providers reported completing interdisciplinary communication, but only 3% of patient files documented team communication. And 33% of TBI patients who received in-hospital physiotherapy reported outpatient physiotherapy referral. Now over to you, Lizzy.
Thank you. Right, so this was last year's focus. A lot of it focused on the hospital side of care transition, but this year, year 2, we shifted our focus to the home side of care transition. So what exactly did this entail? Well, the bulk of our work involved designing, firstly, a survey tool specific to patients and caregivers to understand what are the major barriers to following up with outpatient referral and receiving the rehabilitation services they need. We will also conduct interviews with the actual outpatient PT providers in order to understand their perspectives on the referral process as a whole. And a final round of interviews will hopefully shed light on the organizational characteristics that may or may not affect the implementation of a care transition framework. So Vignesh and I will be traveling to Uganda this summer in order to carry out this data collection period and align with our colleagues as well, who we've been working with all year. So as we shift our focus to the future, we hope to actually implement and design a discharge planning tool that is both culturally appropriate to Uganda and a tool that will essentially enhance the connection between TBI patients and the outpatient rehab that they need. We also hope to study the sustainability of such a tool, and if we're successful, adapt it to all these realms of rehab services, not just physiotherapy. And if we achieve these long-term goals, we hope that TBI patients will have an expedited full recovery and achieve the recovery that they need. And we wanted to say thank you to Duke Global Neurosurgery and Neurology, our leaders at the Embraer University of Science and Technology, Bass Connections for giving us the platform to share a project, and you all as well for listening. Thank you so much.